Dental public health is something that dental hygienists need to be educated on. We have a lot of individuals who are not served well by the current dental care delivery system, and so the education of dental hygienists in dental public health is very important.
The workshop here that's offered every single year, it's a learning opportunity as an educator and as a dental hygienist, but I think that also you have to give recognition to the people that put on the workshops. You've got two really good nationally known individuals here at UNM with Demetra and Christine Nathy, and they're authors. They do a lot of national speaking. They have a wonderful national reputation.
I teach public health, and I use Christine's book, and I just feel like it's a really good book in the fact that it doesn't water it down too much. It gives the students what they need so they can actually perform research and community projects.
One of the nice things about this workshop is that it's very interactive, so we get people from all over the United States that understand what's happening in their state, and we can really learn from each other on programs that work, on issues that we see in different states, and on solutions that have worked as well and those that haven't worked.
So far I've been really impressed. Continuing education that's geared for educators is different than just regular CEUs. It is more education-based, and so we talk about standards and ways that we can really contribute to our program, not just our professions.
The idea is that we can actually move dental hygiene and preventive services outside of the four walls of private practice and into the communities, such as schools, at school-based health centers, in long-term care facilities. We go to the prison system, we work with Indian Health Services. A lot of those clinics, we try to get our students out there, and so it's important that we as teachers learn how to make those contacts.
Right now, only half of Americans actually see a dental provider on a regular basis. So we really have a lot of work to do in that area, and I think that this public health workshop is definitely something that is changing the way that dental hygienists are practicing.
What I've learned over the years is that there are people that just cannot get care without us bringing it to them. In Sandoval County, we actually go out to the Head Start programs, and so we use our hygienist and our dentist, and we take all of our supplies and we go out to them because their parents have no way of taking off of work, or they don't have a vehicle to transport them to us.
Every year we get people that are from across the United States, so we learn a lot from each other, and it's also a great place to visit. And it's right before our balloon fiesta, so it's really one of the best times of the year here in New Mexico.
There's nothing like, you know, stepping out of your hotel room and all of a sudden you see the skies lighted up with all these balloons and trying to pick out what all the different designs are.
Another thing I think that is great about New Mexico, other than the balloon fiesta, I mean, the Rio Grande runs through New Mexico, right through Albuquerque. We have great chili. We have the best chili in the nation.
Now that I've seen the campus here and gotten to meet some of the instructors, I think that I would feel confident recommending this to a student that wanted to continue in their education in dental hygiene and maybe go for that next level.
The profession itself, it's just a wonderful opportunity to be able to get out into the public and actually benefit and, you know, serve the public, and that's kind of what I think is really needed at a lot more institutions, is to be able to have the students taking what they've learned out into the community, and this program actually does a lot of that.
What I would like the participants in this conference to walk away with is that they are able to educate students who are able, as dental hygienists, to make changes that will ensure dental care access to all. So it's a long-term goal, but that's what this workshop was started and continues to have as the #1 goal.